Question number 7, Honourable Annette King.
Thank you, Mr Speaker. My question's to the Minister of Health. What recent reports has he received of staff shortages and the impact of such shortages, if any, in DHBs?
Honourable Michael Woodhouse.
On behalf of the Minister of Health, I've received a number of reports outlining staffing issues. The most recent revealed that while the $24 million bowel screening pilot is delivering results, the biggest constraint to a national rollout is a shortage of professionals to do the colonoscopies, which will require an extra 100. I've also seen reports that the health workforce was short of 1,400 GPs, that 1 in 4 nurses at Capital Coast had quit in the last year, and worse, 45 GPs at Southland actually wrote their dismay to the Southland board about the resignation of 12 senior doctors. These, however, were all in 2007 and 08, part of the workforce crisis legacy that member left behind.
Point of order, Mr Speaker.
Order.
Point of order.
This is a point of order and it will be heard in silence.
Could I ask, Mr Speaker, through you, that the Minister table that advice, because there was no Health Workforce New Zealand in 2007-8.
This is very easily resolved. In effect, the member is asking if the Minister was quoting from an official document for it to be tabled. If the Minister wasn't quoting from an official document, he was not quoting from an official document.
Yeah, he made it up.
Order.
Made it up. Supplementary question, Mr Speaker. Supplementary question.
I'm trying to assist. Order.
No, I'm very happy, Stephen.
And I'm on my feet. I'm trying to assist the member asking a supplementary question. I require a little bit of assistance from her colleagues. Supplementary question. Point of order, the Honourable Gerry Brownlee.
Mr Speaker, your ruling was correct before, of course, but the members on the other side immediately challenged then the veracity of what the Minister was saying in his answer. I wonder if you would consider, should he decide to seek leave to table the press releases verifying his suggestions, that in this occasion you might let him do so.
One will never know. It'll have to see what happens at the time. Supplementary question, the Honourable Annette
Was
King.
he advised by Health Workforce...
Order. I have a point of order from the Honourable Michael Woodhouse.
Mr Speaker, I seek leave to table a document. It may not be readily available.
I want the source of the document.
It's from the New Zealand Medical Association, press release dated 28 March 2007.
No, I'm not prepared to put that leave. Supplementary question, Honourable Annette King.
Was he advised by Health Workforce New Zealand just over 3 months ago that there will be a shortage of nurses starting in 2015, that measures to address the gap needed to have started 2 years ago, and if changes are not made to recruitment, retention and increased supply, then, quote, the future of clinical and fiscal sustainability of health services will be put at risk, end quote.
Honourable Michael Woodhouse.
No, Mr Speaker, I'm not in a position to, on behalf of the Minister, to verify the veracity of that advice. What I would say is that I am advised that the healthy nursing workforce has increased by over 3,000 under this government, and that is delivering better, sooner, more convenient service.
Supplementary question, Honourable Annette King.
Is he aware that only 600 of the 1,328 new graduate nurses, or 45% of them only, secured nurse entry to practice positions 2 months ago, down from 59% in the last cycle who got jobs, both appallingly low figures, showing little acknowledgement of the looming nursing shortage and a looming workforce crisis?
Honourable Michael Woodhouse.
On behalf of the Minister, I note we segue deftly from not enough nurses to far too many. But I do note I would note the more recent data that I have seen that suggests that considerably more than half of the nurses that graduated in 2013 now have places. That's an ongoing process, and I'm confident that DHBs are continuing to place further graduates.
Supplementary question.
Supplementary question, Honourable Annette King.
Has Health Workforce New Zealand told him that their information database latest reports that there are now fewer actual midwife full-time equivalents in DHBs at 977.3 than there was in 2007-8, when there was 1,020 full-time equivalents, making a mockery of his commitment to strengthen the health workforce and leading to huge pressures in DHBs and on midwives?
Honourable Michael Woodhouse.
Well, Mr Speaker, I'm not in a position to verify whether the Minister has seen reports of that nature, but he certainly has seen reports on the maternity workforce in crisis, where 30% of midwife positions were vacant, as reported by the Dominion Post on the 10th of October 2008, under the previous government's watch.
Supplementary question, Mr Speaker.
Order. Supplementary question, Honourable Annette King.
Has Health Workforce New Zealand told him that over the past 4 years, full-time equivalent nursing positions around the country have increased by 4.4%, while inpatient numbers have increased by 16%, and nurses are now reporting instances of care rationing, increased falls, medication errors and pressure injuries, all indications or red flags that point to insufficient staffing?
Honourable Michael Woodhouse.
On behalf of the Minister, I'm not in a position to verify that, but what I can verify is that the DHBs all across the country have invested the extra resources they have been given very wisely, and that has resulted in several 100,000 more first specialist assessments, several 100,000 more surgical procedures, fewer people having to, well, no people.
Order.
Mr Speaker, the question was about nursing. We've moved on to wider issues that are irrelevant to the answer, which the Minister said he couldn't verify.
Order. The member makes a reasonable. The question was actually answered very quickly. The difficulty I had is the length of the question in the first place. If it had been a shorter question, I could have dealt with it more appropriately. Honourable Annette King, supplementary question. Order. Supplementary question, Honourable Annette King.
What does he say to new graduate Freya Head, who has spent $1,000 attending interviews for jobs since November, has a $48,000 student loan, is happy to work in any practice area, still has no position, and is working 7 days a week teaching swimming? And how can that be building a stronger health workforce, as promised by the National Party in 2011?
Order. Honourable Michael Woodhouse.
I say to that correspondent that the process of recruiting nurses all around the country is an ongoing one, and I wish her all the best in her search, confident that a government that has under this watch placed 3,083 nurses full-time equivalent since coming to power will have a much greater opportunity of getting a job than under any other government.
Point of order. Dr. Russell Norman.
Thank you, Mr Speaker. I seek leave to table a document prepared by the Parliamentary Library that shows Auckland house prices have gone up by 54% since November 2008 to February 2014.
Order. On the basis that it was a substantive argument earlier. Leave us sought to table that particular research from the Parliamentary Library. Is there any objection? There is no objection. Point of order.
Mr Speaker, I seek leave to table the advice by the Real Estate Institute of New Zealand showing that house prices in Auckland have in fact gone up by 26% in the advice that's been provided to me by the Ministry for Business Innovation and Employment.
Described. Leave us also talk to table that information from the Real Estate Institute of New Zealand. Is there any objection? There is none. It will be tabled. Question number 8. The Honourable Dr. Peter Sharples.
Tēnā koe, Mr Speaker.
Tēnā koe.
To the Minister of Tertiary Education.